talk about the digestive system, from food to poop, so to speak. Your food tube, the gastrointestinal system, includes the digestive tract as well as digestive glands. Food is taken into the oral cavity and ground up mechanically by chewing. So the first thing you do is you take a piece of food and you chew it. And that is one part of digestion that we do already. When we look at digestion, we look at the breaking down of large food particles like a piece of bread into small food particles like a glucose molecule that we can then easily absorb from the intestinal tract, the gastrointestinal tract, to the blood system. The mouth has salivary glands in it, and salivary glands, they create your saliva, your spit. That's about 1 liter to 1.5 liters per day, and a liter is about a quart, more or less. And it does that daily, and what that does then, it lubricates the food, and it makes the food by chewing it and making it, putting it together, mixing it up with that lubricant. It makes it into a semi-liquid bolus that we can then swallow. And saliva is in part what it contains. It contains amylase, and amylase is an enzyme. And you remember enzymes, when we see a word with an ASC at the end, ASC right here, that's an enzyme, and that helps break down metabolic processes in terms of the system. The chemical processes are driven forward by enzymes, so they're very important. And amylase is an enzyme that digests carbohydrates. It digests food type stuff, vegetable type stuff, and it does that. And that process is then not mechanical digestion. That's when we chew things up. That is chemical digestion, because the chemicals break down the food particles. And so we have both of these types. We have mechanical and we have chemical digestion throughout the system. The tongue is a muscular organ that helps the chewing, and it helps the transport of ingested food. It also is a sensory organ, so it senses touch and it senses taste. Taste is in the last sensory chapter, in the last portion, where we have different tastes. We of course, this is sort of like a joke there with the chocolate in the middle in terms of the taste. But we have salty, we have sour, we have sweet, we have bitter, and we have umami, which is sort of the beefy, flavory taste type. But the tongue also has a role in speech. It helps us create speech. It helps us with consonant creation. Extrinsic muscles move the tongue around, while intrinsic muscles shape the tongue in terms of how it looks. The tongue, you can shape the tongue, and you have to also move it around inside the mouth. Well, I hope it's inside the mouth. Then we have teeth, and teeth help us in a mechanical digestion. It helps us in cutting, it helps us in tearing, it helps us in grinding. We have incisors, we have canines, and we have molars and premolars. And they are arranged in 2 rows. We have them anchored into the upper row is anchored into the maxilla, and the lower end is anchored into the mandible. And when we look at the dental formula, meaning how many teeth do we have incisors, 2 of them, on each side, right and left, in the upper as well as the lower compartments. We have then 1 canine on each side. We have 2 premolars, and we have 3 molars. And when we look at the milk teeth, which are the teeth that first come in, the baby teeth, we can also call them deciduous teeth. They arise between age 6 months to about 2 years, and they miss the molars. They miss the 3 back teeth. So they have all of the 4 ones. They have the 2 incisors, the canine, and then the 2 premolars. And then the permanent teeth, the adult teeth, they start coming in at about age 6. That's when they start showing up. Structurally, a tooth can be divided into a crown, the top here, above the gum line, a neck, and then a root. The crown extends above the gum line and is covered with enamel, this white stuff. And enamel, that's the hardest substance in the body. The root is covered with cementum, and it is anchored via the periodontal ligament into the bone. So here's the cementum, that's just here, and the periodontal ligament anchors it into the bone. The root canal at the apex allows for nerves and vessels to reach into the inside, which is the pulp on the inside. That's the pulp. And the pulp is where we have odontoblasts, and odontoblasts secrete dentin, and dentin is this darker material, this brownish beige material in this drawing here. That's the dentin. That's the bulk of the tooth. And the odontoblasts, odonto refers to tooth, and blasts are immature cells that create material. They create a lot of material. That's their main job. So that's kind of interesting. When we swallow, we have teeth that can chew the food mechanically, digesting it. We have the tongue that helps with that. We have the saliva that binds with the food, digesting amylase, digests carbohydrates already. We have also proteins as well as fats that we eat as macromolecules. Those will also be digested, but not in the mouth. In the mouth, we mainly start with the carbohydrates. And then now we have the tongue then combined with this saliva bolus that we now need to swallow. And swallowing is, the term for that is deglutition as an act, and it's the process that will get the food from the mouth, the pharynx area in the back of the mouth, to the esophagus, the gullet. And make sure through the swallowing process that food does not go into the trachea like we have in the respiratory system, what we just discussed previously. So the beginning phase of this swallowing is voluntary. So we start wanting to swallow, and as soon as we press the bolus against the soft palate in the back, we trigger an involuntary reflex, and that reflex raises up the larynx and has the esophagus cover up the glottis, the hole that goes into the trachea. And so that way we assure that we get the bolus going into the esophagus and not into the trachea. So that's basically what that is all about. And then from there, the esophagus brings the food into the stomach. But what happens once in a while, when we talk and we have a good time and we eat at the same time, we get a food particle that goes into the trachea, and we choke. And so when we choke, we have the food reach some of those rings, and it gets dislodged in there, and we need to get them back out, and we do that through the Heimlich maneuver. So the person itself has a hard time. They can't speak because we can't get air going out from the lungs past the vocal cord so we can make sound. So we have to sort of create a sign, and the sign is we hold our throat. We can't speak. And what we then do when we see that person, we go behind them and we reach around them. But we want to make sure we take a fist and we bring the fist far below the xiphoid process, because if the xiphoid process breaks off, the diaphragm pulls that xiphoid process backwards and punctures the liver, and that can be very dangerous. So we want to make sure we have a fist in the stomach cavity, and we reach to inward and up, not just up. We reach inward and up and push the force there for the air outward into the thoracic cavity, and that increases the pressure inside the lungs, inside the pleural cavity, and we hopefully are able to push that food out that way. It's kind of like coughing that way. So that's what the Heimlich maneuver can accomplish, and it's of course it's life saving. Unfortunately, it's a dangerous situation. And then after we do the Heimlich and we get the food into the right tube, we get into the gullet, and the gullet is the esophagus that transports the bolus from the larynx to the stomachs, and it penetrates the diaphragm, and that's called the esophageal hiatus, and then that one connects to the stomach, and we get the food going into the stomach. And the stomach is going to be very, very acidic, because the stomach is where we're going to denature a lot of the proteins and digest a lot of that stuff chemically, break it apart, as well as muscularly. And we can get sometimes some regurgitation of this gastric acid going back from the stomach into the esophagus, and that can be painful, and that pain is described in heartburn, because it feels like the heart is burning, but it's the food, the acid that goes into the softer tissue of the muscular tube. The esophagus is a muscular tube, and it doesn't tolerate that acid so much, so it starts burning and it hurts. And so what we can do now is we can look at the wall of the GI tract, because the gullet's wall, the esophagus walls, represent the structure of the entire gastrointestinal tract as a whole. And it's kind of like when we looked at the blood vessels. It's a tube type structure. So we have different layers. We have an inner layer, a middle layer, and an outer layer. And the middle layer, as in the vascular system, is muscle. The inner layer is epithelial type stuff, and the outer layer has a lot of collagen fiber and anchors the structure into the surrounding tissues. And so the inside here in the gut tube, the GI tube, is called the mucosa, and it's overlaid by the submucosa, and then there we have the skeletal muscle coat, and we have in the muscle coat, it's actually a smooth muscle coat, that's a mistake there. But in the muscle coat we have an internal circular layer and we have an external longitudinal layer. And that helps with bringing the food forward, moving the food, transporting the food forward, and also, of course, breaking the food down when we squeeze it. And then outside the anchoring layer, the superficial layer, is known as the serosa, and that anchors the gut in its surrounding structures. So when we talk about that food going forward, that's a process of peristalsis, and that's an alternate contraction and relaxation of the two muscular layers that facilitates the movement of the ingested material in a one direction. So when I contract the circular layer, the bolus stops here, it doesn't go backwards, and then I can contract the longitudinal layer and then move the bolus in this here, and then contract the circular layer, and that way rhythmically do that and move the bolus forward that way. So that's kind of a neat situation. And that brings us to the stomach.